welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to talk about the future of healthcare. Today, my guest is David Ryan of Intel, where he is General Manager for Health and Life Sciences in the Internet of Things group. Dave helps the global health and life sciences device industry transform care at the edge. His customers are the manufacturers who build life science research instruments, as well as medical equipment, appliances, and devices used in hospitals, clinics, residential care settings, and the home. Dave has spoken across the country and internationally on the challenges and opportunities in an aging world and is active in industry associations and international initiatives worldwide. Welcome, Dave, and thanks for joining us.
Oh, thanks for having me.
So I used the phrase Internet of Things at the dinner table at home recently, and I was nearly laughed out of the room. My family didn't think it was a thing. So for starters, Dave, how would you define the Internet of Things?
All of the things in our lives are connected, and if they aren't, they will be. And they're more intelligent, and they are going to be performing functions for us. So the refrigerator is a thing. Refrigerator that's connected to your shopping list is a thing that's part of the Internet of Things.
So
it's
my
connection.
Refrigerator that knows that I'm out of milk or that knows that I'm on vacation can act appropriately?
Yes, in support of your life, your diet. It's taking things that have been, let's say, inanimate, simple, and making them smart and enabling them through a connection to the world of information and intelligence and analysis that's available through the internet to make that product perform better for the person who's using it.
Okay, and it could be performance along a variety of different axes or metrics. So it's not necessarily all about connected sensors, remote sensors, for example, or is it? Is that a big part of it from your perspective in the healthcare space?
Well, if you take things from the healthcare space, inside the hospital and outside the hospital are two different stories. Inside the hospital over the past 10 years, just about every device that has any purpose to be made more intelligent and more connected is, from the bedside to all forms of scanners and medical equipment, to eliminate the paper that's involved in recording the readings and to facilitate the workflow of the nurse or the doctor. So by connecting up all these different devices, putting the behavior and the function of those devices into digital information and put it into the hands of the caregivers, then it supports improved care inside the hospital, reduction of errors inside the hospital. Now, outside the hospital, as care shifts and transforms to be able to be delivered where people live, where they are, either in the community, in their home, or in the residence that they live in, sensors are key there. And so if you say healthcare in the home, then yes, it's about helping the individual who's managing someone's case have much better information about how that person's doing in between the office visits.
Right.
So it could be taking vital signs. If someone's suffering with cognitive impairment or memory impairment, some things, simple things like, are they in their apartment? And there are countries where someone who has left their apartment when they're normally don't, there's a social worker who will drive over and check and see that they're okay.
Right.
So I think it's the sensors is a starting point, but it's then taking that information, integrating the information that comes from sensors or measuring devices, and making that available to someone who's providing care and managing a case. Now, it's not the only thing. Communication or connectivity, staying connected. So folks living independently, and especially if we're talking about the aging demographic, social community connectedness to the family is critical in terms of health and wellness. And so Internet of Things type of technologies that can be used in the home also bring more connectedness to the family, not just the caregivers. And that's really a key part of a health strategy is support, purpose, and connectedness for the individual. And that doesn't have that much to do with taking a vital sign, although that's important for their health care.
Right. So it's a much broader vision of an individual's life, an individual's independence, if you will, if you're talking about sensors in the home, technology that can help them in day-to-day activities and experiences. Are there particular things that are enabled by the Internet of Things that could not be enabled by traditional healthcare, social work, other kinds of interactions with individuals, or is this just a tool to do it better, faster, cheaper, different? Are we enabling something new?
The Internet of Things enables, the way I think about it, is a whole new chapter of the book of how to practice and take care of folks. The model, created in the 1800s and still pervasively deployed today, is that the individual episodically, once a month, every 3 months, every 6 months, comes in a hospital or clinic, sees their primary care physician, or even if they're being treated for chronic disease, diabetes or whatnot, or Alzheimer's or dementia, come in for a check, 6 minutes, 12 minutes, 17 minutes, and disappear. And so the practice of medicine has been entirely confined into those 6 to 17 minutes every 3 to 6 months. What the Internet of Things does is allow the information, communication, and connectivity, and to be in touch with the individual, and for the individual to be in touch as well with the care system when they want to, all the time and throughout their daily life. And we've seen in research, for example, the research that we support at the Michael J. Fox Foundation, providing connected measurement on Parkinson's sufferers, was able to see changes in the effects of their medication throughout a day and over from day to day that can provide much more insight to the physician as to how to dial the medication for that patient, rather than the way the patient was behaving during the 6 minutes they were in the office at one time.
Right.
So
not necessarily representative.
Right. So it doesn't replace what happens in the office, but it shines a light on what until IoT has been the dark corner of how the healthcare system can take care of folks. They just can't see there. Just having this data, these measurements coming in, that's just data. And it's a flood.
I was going to say, I mean, some of the recipients of this data will be saying, I don't want all this data, or only alert me if we're out of bounds in the following ways, or something like that.
Yeah, turning the data into insight and actionable, helpful alerts and cues is critical. And so you see lots of innovation related to, let's say, using analytics and artificial intelligence to look at the data based on training, and then, for example, prioritize the patients and who needs to be seen for physicians or the clinicians based on the data that's coming in.
So instead of a 3-month visit, it'll be a 1-month visit for Mrs. Jones because what's happening out in the real world.
Needs the 1-month visit, and maybe the 3-month visit's not needed for many other folks.
Right.
So so for triaging or prioritizing where to focus attention, that can be done, and there's many solutions being developed, but applying advanced analytics, artificial intelligence to this flood of data can convert, and is converting it into sort of nuggets of insight and critical triggers of action.
So the device design and the analytical tool design, is that happening in conversation with device manufacturers, with clinicians? Or what kinds of conversations are you as a company involved in terms of development? Or is this what I'm familiar with from the consumer field? We all see the Intel Inside sticker, and there's an Intel chip. Does it go beyond that in this setting, or is it an enabler of the kinds of things you're describing?
Across the spectrum you mentioned there, from devices to maybe the way the data gets connected and brought up into the clinical systems and handled by researchers and doctors, what's common across that entire spectrum is the analytics and the application of artificial intelligence. So we have a conversation with a device builder or a sensor builder, includes AI. How can they train the device they're building to be smarter about the data that's capturing and what is shipping up? And then you go to the other side in terms of medical research and It's all about using artificial intelligence to increase the productivity of research, accelerate discovery, and then take the training and be able to then to deploy the training to be able to automate and assist the clinician. It could be a radiologist, dermatologist, ophthalmologist, any practice to assist to be able to more quickly bring the human attention to the piece of information that needs that human touch.
You mentioned a couple of different specialties. Are there any particular specialties that you see as more ripe for innovation or intervention along the lines that you've been describing?
It's pretty across the board. I'm trying to think of pockets where there's not the application of advanced analytics or AI or the connection of things. And that's a hard one. Now, the maturity is different because different areas started sooner. So,
sure, different specialties were more mature in terms of their use of data and standards and so forth. And so being able to key into that, I'm sure, is easier for whether it's something like cardiology or orthopedics versus something else.
Cardiology is anything imaging. Mm-hmm. So anything imaging is a real starting point. For hospitals, images were the first data flood. Mm-hmm. Looking forward, genomics and sequence data will become the next wave of data tsunami inside hospitals. Genomics has been the data tsunami for research.
Right.
And so genomic research and working with sequence data has been the driver of advanced analytics and research inside the hospital. That is image data. Now, even cardiology, digital pathology, CAT scan, PET scan, MRI, all those images digitized a decade or more ago, and then using advanced analytics and intelligence to try and improve the productivity of the radiologist and give them clues and annotate images. And it's not a finished effort, but probably some of the longest tenured applications of advanced analytics in the hospital system. And now you see hospital-wide surveillance for and risk scoring the patients in the hospital, see who needs attention and who might be at risk of becoming toxic shock. Now we hop outside the hospital. The remote care, distributed care kinds of technologies began pretty passive, began pretty much as first early runs at this were just take a vitals, take a weight, take a measurement, and ship it up into a record and expect a doctor or physician to do something about it. That didn't work.
Yeah, so that was sort of 1.0. I mean, that's the kind of thing that we saw
1.0 didn't work
10 years ago,
yes.
And everyone was very excited about it.
Right. But now the solutions are proactive. They are intelligently monitoring the data that's being taken right at the point where the data is being taken. They're interactive with the individual related to maybe behavior modification to improve, let's say, medication adherence. Also, they provide more connectivity with the patient's carrying circle, not just the clinician, but the family. So when you sort of have more of a complete behavioral solution for someone's life as they are cared for with a chronic disease or they've been discharged from the hospital and they're trying to recover, it's much more effective. And so there's more intelligence and more function being provided today, and these work. And then as they're integrated into the hospital system, they're now much better integrated to the workflow of the hospital and the clinician flow of the hospital system. And there's much more AI-based and advanced analytic automation on the data to tear down that data to the key insights that can be really helpful to the case management team. And these work. These are working. And so the vision of this remote care or distributed care model has been there for 20 years. We have and others have started researching this and trying to do tests 20 years ago. And it's been a very, very slow growth of actual deployment. But today, there's well more than 10 million people being monitored remotely who would otherwise be at risk, maybe needing to pop into the hospital. And that number now is growing at a sort of a 40 to 50% a year rate. And so the evidence of the effectiveness medically and the evidence of the effectiveness from a cost and efficiency has piling up now. And so hospital systems all over the country are accelerating their early deployments, and those that haven't been doing this are now starting.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Dave Ryan, General Manager of the Health Sector Business at Intel's Internet of Things Group. We've been talking about the uses of health sensor data and analytics around the data to inform care management. But today, data security is top of mind for many in the healthcare sector. Is there a key area, or are there key areas of vulnerabilities that you see in this regard? And what are the sorts of approaches that your group is taking to stay ahead of the curve on security?
Security is a major topic of discussion with everybody we work with, whether you're talking about devices in the hospital that they build, or devices that are in the home, or the data centers of the systems where they keep and analyze information. We have a legacy in hospitals around the world of medical devices with really simple, you can think like, remember the old serial port type of connector. And none of these were built with security in mind. None of these were built with the notion of a cyber attack in mind. So what's happened in the hospital is a first wave of innovation related to security that's been happening over the last 10 years, is to put something in place that isolates that device so that it can't be accessed from the outside. But now there's not a medical device manufacturer on the planet who's not designing in security from day one into the new products that they're building. And this is a fundamental discussion that we have in terms of how we, as a vendor to them, how we supply them with the technologies to do that. There was an interesting turning point in the healthcare system of recognizing the security threat relative to the devices. For the longest time, it's been considered to be needing to protect the device and the patient from a cyber attack. Hospitals might do risk assessments, and the chances of that happening, so low, right, that it's hard to move. However, over the last 5 years, there's been examples and a growing recognition that the bigger threat is the infection of that medical device and turning it into an attacker of the entire network. And so denial of service inside a hospital, or the recognition of the scope of the potential damage or threat of a medical device being attacked, has gotten more comprehensive. And that is a really accelerated movement in terms of the requirements of the deployment requirements that hospitals place on their vendors have now leapt way ahead related to security. And I would say 6 or 7 years ago, I could not make the statement that every medical device company we work with is designing secure systems, but absolutely, without a doubt, that's true in the last couple of years.
Sure, it's got to be table stakes at this point to be able to
it will
play.
Become. Mm-hmm. It will become. And I think that was a light bulb that went on in the healthcare industry's head, was the assessment of the different type of risk. I think the risk of a device being hacked to kill somebody, right? It's real, but an extreme and sensational. The bigger risk is the device being hacked to then become the attacker of the entire network. And that's much more
and
possible. Looking
at a much broader range of devices,
yes.
The much more pedestrian, that's just it's an avenue in for an attacker. Right.
Now, if we take your question, we go outside the hospital to remote care and in the home, there's, I think, a greater sense of concern or interest from the people that are being cared for related to their own personal data. We believe that when someone's inside the hospital, they have not just the expectation that their information is private, they've come to experience that their information, personal health information, is protected by their healthcare provider. As an aside, perhaps too much so. Somebody who needs to get their images from one provider to show them to the other provider might feel that there's a bit too much protection of that data because of how hard it is to get it moved over. But you talk about now caring for folks in their home. then it raises questions that are still being researched about what people will accept and expect. And generally speaking, we see that if somebody has been discharged and they're recovering, if someone has a condition that's being taken care of, that takes prominence over those other concerns. But those hubs and those devices that are used are today being built with advanced security just built in, again, for the same reason, is so that they don't become a target to be attacked that then becomes the attacker.
You said earlier you sort of identified ways in which the sensors combined with the intelligence can be used to sort of change course of treatment, course of care, or the approaches to care. I guess my question here is, are we at a point, do you see the system as a whole at a point yet where we've made a sufficient investment that we're now saving money? There's been a lot of investment in technology that has not necessarily achieved its anticipated ROI. Do you see that happening in this space? Have we crossed that divide yet, or are we close? Or what are your thoughts on that?
It seems that the characteristics of a new processor deployment that drive results, the outcomes and costs, are becoming clearer. So through the learnings from the failed experiments, the interactive, proactive, enabling connection, and with very good, this is a boring topic, but very good integration with the hospital's administrative and clinical systems makes things work.
Right.
Okay. If a tech company is working with a hospital or a community and doesn't tick those boxes, then the risk of the failure goes up. And the kinds of things that are working across the board as well, inside the hospital and outside, are, like I mentioned, triaging. So this using the automation of the analyzing the data to help prioritize the attention of the clinician, either to patients inside the hospital who have higher risk or those outside, those have phenomenal results. Also, they drive a very high level of acceptance with the clinicians. If you have a cultural resistance amongst the clinicians to doing something new or doing something in a different way, it just stops dead. And so but what we've seen is that once these first generation deployments occur and the physicians, all the clinicians see the improvements occur, then the satisfaction and the interest in adopting just goes through the roof in the institution itself, because they want to help people.
Sure.
Yeah.
Sure. And so the good results tend to replicate themselves then, and expand. Well, terrific. So to wrap it up, I will ask you my favorite last question, which is, if you were to wake up tomorrow and find yourself 5 years in the future, what is one thing that you would hope or expect, your choice, to be radically different in healthcare?
Oh, one of these questions. So we're not at the Actors Studio. I think mark 2018 on your calendar, because I think 5 years from now, we'll all be looking back and it'll be just a foregone accepted conclusion that this year, give or take, was the year that the healthcare system had the lights turn on for remote care. That there's so much evidence building that remote care is effective. In fact, that remote care is oftentimes better than the standard of care done inside the hospital. And 5 years from now, we'll look back and we'll say 2018 was the year where things changed and remote care became a standard of care.
Great. I'll mark that in my calendar, and we'll check back with you then.
Okay.
Thank you very much.
I've enjoyed
David. This conversation. You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.